Hello, I'm Dr. Ashlyn Reiser from Sibia Eye Institute. I'm here to tell you today a little bit about what glaucoma is and how we treat it. Glaucoma is a disease of the optic nerve, the cable that connects the eye to the brain. Typically, we see the optic nerve die in a very specific way in response to high eye pressures, although many patients who have glaucoma actually have statistically normal eye pressures. If you think about your optic nerve like a donut, like an actual donut, you have the donut and then the hole in the middle of the donut. In patients who have glaucoma or look suspicious for glaucoma, the hole in the middle of the donut is a little bit bigger and there's very little donut. As glaucoma progresses, that hole gets bigger and bigger until there's no donut left. And it causes vision loss from the outside in until it's like looking through a straw, and then eventually everything goes black. Any vision that's lost from glaucoma we typically can't regain, so it's very important that you come in for your regular screenings and to monitor you to make sure that your disease isn't progressing if you have it. People who are at risk for glaucoma, all of us can be at risk for glaucoma, but the biggest risk factor for you is going to be family history. We also find that our patients from various walks of life, whether they're our Hispanic Latino patients, our Afro-Caribbean patients, or our African American patients, are typically at higher risk for glaucoma, for primary open angle glaucoma. And when we see these patients, oftentimes when they do have the disease, it can be pretty advanced. And so if you think you have a family history of glaucoma, or if somebody in your family is blind and you're not sure why, it's important to come in for an eye exam so we can see how your eyes are doing and monitor you for this disease if you are at risk. Depending on the type of glaucoma that you have, there are different treatments that we can offer you. Glaucoma typically is treated by trying to lower the eye pressure. Oftentimes we offer patients either eye drops or a laser procedure in the office. We put you into something similar to this to open up the drainage pathway of the eye. Studies have shown that regardless of how we treat new patients with either drops or with laser, their long-term eye pressure reduction and ultimate progression of vision loss is equivalent as long as patients come in for their regular follow-up and are monitored regularly. We do also offer more invasive procedures like minimally invasive glaucoma surgery that we typically perform at the time of cataract surgery to further lower your eye pressure. The most important thing for you to know about glaucoma is if you're at risk for it, and the only way to know that is to come in for your yearly eye exam. Knowledge is power, and so the more information you have about the health of your eyes and your body, the better, and the better we'll be able to treat you over the long term. We can't wait to see you here at Sibia Eye for your routine eye exams, and if you have any questions, give us a call.